Well, hello, everyone, and thanks for joining us today. We're going to dig a little deeper into the functionality of the Medical Disability Guidelines, the MDG. As you'll see, there's a lot of potential to use this tool to improve alignment for all involved. Janice is now going to take us through the case details that we're going to use today for our demonstration.
Great, thank you. So our case today, it's going to be a 58-year-old male who's an automotive technician, and his workload is defined as that medium strength. Strain involving his upper right shoulder and upper arm, and he injured it during a tire changing job, and it is tire changing season. He is right hand dominant, and it's his third time injuring his shoulder. He has a BMI of 41, weighs 325 pounds, and is 5'9". He has pre-existing depression and is quite anxious about his recovery and getting back to that career and his occupation that he is skilled and trained for. I'm going to bring up the MDG site here now. And Todd's going to walk us through probably a very common space, but I'm just going to put in our diagnosis. Sprain, strain, shoulder, and upper arm. Here it is. I'm going to scroll down to the space here that shows the length of disability.
Perfect. So the first thing we'll highlight in the length of disability section for our purposes today, we're talking about a grade 2 shoulder sprain strain. So not something that would be surgical like a grade 3. Now, when we go into the chart, and you'll all be familiar with this, you're going to see that there's going to be 3 columns. So there's going to be a column for minimum, optimum, and maximum. So what that speaks to is that the fact that this is not a precise down to the actual day type approach, but it rather gets us into a predictable range. I'm going to talk to you just for a minute about disability duration guidelines, so DDG, which is what you're looking at now, versus treatment timelines. We're going to step aside from our auto mechanic for a second, and we'll use an administrative assistant. So this person trips on a phone cord, goes down to the ground, breaks his left arm. So the DDG for this person might be just one day, enough time to go down and get a cast and an x-ray and back to work the following day. So one day for sedentary occupation. But the treatment timeline, the amount of treatment that this person will require once they come out of cast, presumably about 6 weeks later, would be somewhere in the 6 to 8 week range. So disability duration guideline 1 day, treatment timeline could be 8 weeks, not even starting for another 6 weeks. Now, if that person had a different occupation, say a carpenter, then that DDG would be very different because that person couldn't necessarily go up on a roof that next day with a cast. So the DDG would be very different for these two, even though the injury was exactly the same. The treatment timelines for these two would be potentially identical. Okay, so let's go back to our automotive mechanic. Remember, we're going to look at the max DG of 21 days that Janice is highlighting for us today. Now, we know there can be other factors that influence the duration, and Janice alluded to some of these earlier. And although this person does have a shoulder injury predominantly, we obviously have to look at the whole person and the impact that those comorbidities have on the length of disability. So we'll come back to that, but first of all, Janice is going to take us through the ability to work section.
Great, thank you. So the ability to work section, again, this section is great as it allows you to think about those work tasks and areas that can be impacted, but are not necessarily captured on that functional scan in Form E. However, they could be influencing return to work. So the areas are things like dexterity, dominance, repetitive activities, and/or overhead work. In this case specifically, I will just highlight a few things that stand out. We talked about our case actually having their dominant arm impacted. And as you can see here, it suggests that, if the dominant arm is impacted, it may require some accommodations versus if it was the non-dominant arm that was affected. The next section I'm going to take you down to here is tolerance. And tolerance is something that, again, it is something that can be built up and for many types of work, but this type of work specifically, it suggests that if you put in place periodic breaks, it can help achieve those small increments of improved tolerance with pacing and putting those breaks in place. So it just highlights it just right here. The next section I'm going to also take you in is failure to recover. And so right here, I'll click on this. This section, it's great as it looks at things like the diagnosis, the treatment, and the prognosis. The expected recovery trajectory in almost any sprain strain should always be that of improving. So you should see that on your Form C and E. If you are not seeing this, it is a place that you can look to right here and see if there's questions that might help you answer your why is this happening. So if it's regarding the diagnosis, there could be some questions that suggest it could be around the worker's activities and what they are doing at home. If it's regarding the treatment, it could be something that you're asking those questions to the physio consultant and or the primary clinician on the file. And it could be around what they're doing with regards to their treatment to date and why they may not be making progress every couple weeks. If it's regarding prognosis, these could be questions that you might ask to your medical advisor. And it just helps ensure that we are making these gains bi-weekly. The next section I'm going to bring up here is duration reviews. I'm just going to click on it up here to the right. You can see the tab here says duration views, and it's actually my favorite section. All right, and Todd's just going to speak to this section here.
Yes, thank you. My favorite section too, for sure. So the first thing you can see, there's a job title box, a search box. Janice is going to start to type in auto, and then it's going to pop up. We're going to get a drop down, and we can go right to our occupation. So from there, we can go into the case view tab. And now we're going to start to add in a few details. So we've got a 58-year-old male who does medium work. That's by default came up for us. And now as we scroll down a little bit further, we can see that the system has some default comorbidities. So we talked earlier about this person having depression. So we're going to tick off the depression box. This person also has obesity. So we're going to click that box. And the third comorbidity we discussed was anxiety. Now there's not a default option for that. So we're going to put that in the search box, and you can see as we do so, it'll pop up and we can choose the one that we want. And from there, we're going to hit calculate. So as you scroll down a little bit further, you'll see that remember, we started with a DDG, a max DDG of 21 days as our reference point. And now by using this tool and adding in the comorbidities, we're at 65 days. So it's changed quite dramatically. So I would encourage you to take some time to reflect on some of the past claims that you've had and where the maximum DDG was exceeded. Perhaps, as we've just seen, it was exceeded for all of the right and predictable reasons. If this tool is used effectively, there's no question, it will help us all better understand the expected recovery trajectory and ultimately create better alignment between all of the involved parties. I will add that this approach also dovetails very nicely with the Tier 1 service agreement, where we're encouraged to establish if there are any comorbidities early on that might require for a Tier 1 extension. This tool takes that from an opinion-based approach into a statistically based one.
And as Todd has mentioned, again, early intervention, expectation setting, these are all key things to ensure your parties are aligned and improve return to work outcomes. Our mandatory 4-week case conference has always been a great space for us to discuss this and ensure that it is booked early and often as needed. It allows for everyone to have that informed plan. Again, I hope this review was really helpful and highlighted the features of the MDG. You can always reach out to Todd or I if you have any questions. Thank you.